Welcome to the Sheba training on using the Plan Finder. My name is Liz Mercer, and I'm being helped by Diana Schlesselman. So today we're going to talk about using the Plan Finder, and I have some tools I will be sharing also. First of all, I have a presentation. I'm going to move to that. This is a presentation about tips and tricks for navigating the Medicare Plan Finder. Here's what we're going to talk about today. This is all about practice, so we're going to encourage you to get in there and practice. We'll give you some tips on how to help beneficiaries, your clients, get prepared, how you can prepare yourself. I'll do a walkthrough of the Plan Finder with the PowerPoint slides, talk about enrolling, how we review our results for beneficiaries and share with them, how to find some help and information about frequently asked questions, reporting issues. Sometimes Sheba volunteers find issues with the Medicare Plan Finder, and so I'm going to tell you about how you can help with reporting those issues and sharing some resources. So again, using the Plan Finder really takes practice. So this is a start to show you. I'll show you some tools you can get into. But really what you want to do is get in there and try it out if you haven't already, or even if you have, maybe getting refreshed on how things work. I'm going to point this out a little bit later, but there's some great Plan Finder training videos posted on the Medicare.gov website. And even if you've used the Plan Finder in the past, it's worth spending some time watching those. You might learn some new tips and tricks from watching those. I know I had. When I watched those videos, I had already been using the Plan Finder for a couple of years, and I still learned some things I didn't know. At the end, I'll show you there's some practice Plan Finder worksheets you can use if you want some samples to try a Plan Finder. And I'm encouraging you to ask your questions. You can ask them of your regional training consultant, your volunteer coordinator, other experienced volunteers who've had years of experience using the Plan Finder, and definitely calling us at the Tumwater office in Sheba or emailing us. We're happy to try to answer your questions. So one of the important things about the Plan Finder is that you need some information from the beneficiary to get the most out of this. And so it's important to be prepared because preparations will save you and the beneficiary time and reduce stress. So the most important thing is to make sure the beneficiary has a list of what they should have ready to bring to their appointment, or either if they're going to talk to you on the phone. And the next slide goes over what those items are. It's really going to help if they have their Medicare number and effective dates for Part A or Part B. And the easiest way to get that is for them to have their Medicare card, also their date of birth, their zip code, which is the zip code that's one of record with Social Security, a list of drugs that includes their dosage and quantity. And there's several ways they can get that. Some people know them by heart, but if they take several, or if their prescriptions have changed recently, it's helpful to get an official list. The pharmacy will print out a list for someone. All they need to do is ask for it, the pharmacy that they use. I've also just told people to read it right off of their pill bottles, or even throw their pill bottles in a bag and bring them with them if they're going to meet with you. Spelling of drug names is tricky, so it helps if you have the official spelling. It also is going to help if they have the name and address of their preferred pharmacy, because when we get into the Plan Finder, pharmacy choice can make a difference in price. Also, if they know what their current Medicare plan is, or drug plan, or Medicare Advantage plan, that's also going to help you. And if they're currently receiving extra help, LIS, or Medicare Savings Program, or if they have both Medicare and Medicaid, that's going to help you to know that. If they don't know, or you don't know, you can screen them to see if they're eligible. Also, sometimes a personalized Plan Finder search, which I'm going to talk about in a minute, will give you that information. So for you to get ready, it's helpful to have your form of your client contact form ready, because you want to collect all the required fields, and it helps to do a very nice complete intake. In some Sheba offices, one during open enrollment, one volunteer does sort of an intake while another volunteer might actually run the plan finder for the client. So there's many different ways to do this work, but really you want to make sure you get as much information as you can. And I'll talk in a minute about writing down the drug list ID number and ID password. There's a way to save your work so you can go back later, or the client can go back in later and retrieve their drug list. We'll talk about this in a minute, but it helps to use what we call the personalized search on the Medicare Plan Finder, because it's going to give you back information that's specific to that beneficiary, including showing if the person's dual eligible or has extra help or Medicare savings program. And then it will show the correct subsidy prices for that they should be paying. If a personalized search doesn't work or you can't get the information, don't panic. You can do a general search using the information that you have available. So, how do you get there? Well, I start from the Medicare.gov, which is the main official website for Medicare. It's Medicare.gov, not Medicare.com. Be careful with that. And the home page looks very similar to this picture that you're looking at. There's a couple of ways to get into the Plan Finder. I recommend hitting the green button, which is sort of right in the middle of the page, that says Find Health and Drug Plans. That will take you to the Medicare Plan Finder tool, where you can begin to do your search. There is also a button to sign up and change plans. There's many ways to get into this information, so find what works for you. You can also bookmark this next page on your computer so you don't have to start with the home page. But because I move from computer to computer, I generally just start with Medicare.gov so I know where it is. When you click on Find Drug and Health Plans, you get to a page that looks like this, with this woman on her bicycle looking very happy. And this is where you can start your search. I mentioned doing a personalized search. You'll see here that circled in red is the link to the personalized search. If you just have the person's basic information, you can do what we call a general search, which only really requires the person's zip code. So you can get information even if you don't have the person's Medicare card. Before I talk about going into the search, I also want to point out some other information on this page circled with the big red oval. I mentioned that there are some Plan Finder videos. This is one way to access them. Up on the upper right hand of the page, there are, I believe, 5 relatively short narrated videos that take you step by step through how to use the Plan Finder and what the features are. Each of them is about 5 minutes long, and I highly recommend, if you want to brush up your skills or if you're new to it, to take some time to watch those videos. You'll learn quite a bit about it. The Plan Finder has a ton of functionality. It gives way more information than most people can understand or manage, but it is possible to drill down and get a lot of detailed information about the options that people are looking at. So it's helpful to kind of know how to navigate your way through the system. Additionally to this, you'll see on this page there is some tools, additional tools, and one of them is you can just, if you know the plan name, you can search just for the plan name. You also, from this page, you can go directly to an Enroll Now page. If a person already knows what plan they want to enroll in and you want to help them, this is one way you can skip steps and go right to the Enroll Now button, which will take you to something called the Enrollment Gateway. And I'm going to talk a little bit later and show you a picture of that, but it is possible to assist people to enroll if they're ready and understand that their choice, what their choice is. You can help them with this process. So let's look again at the search options. A personalized search is what we recommend. You do need several items of information to do that, and they have to match exactly with the records that Medicare has on the client. So the first one is their zip code, and the zip code needs to be the one that's on record for their residents with Social Security. You also will need their Medicare number, and it will work with either the old Medicare numbers or ones that are being phased out, which are the Social Security number, or the new Medicare beneficiary identifier number, whatever it's called, should work in the search field. Okay. You will need the person's last name spelled exactly as it is, and their effective date for either Part A or Part B. You'll notice it defaults to Part A, but if the person for some reason doesn't have Part A, you can click on Not Part A, and it will flip over to Part B, so you can put in their effective date for Part B, and their date of birth must all match with the records. But if you make a match and click on Find Plans, it will take you to the page where you begin to add the person's prescriptions. Before I go there, I'm going to show you what happens if you do a general search, though. So the next page is if I had checked just the person's zip code, there are some questions that the general search asks, because in a personalized search, it knows if the person has original Medicare, if they have extra help, and so on and so forth. But with a general search, you have to tell the plan finder what the person's current coverage is in order to get the best pricing. So when you hover over these terms, a box will pop open. I can't show you because this is a screenshot that will explain what the question means. But you can tell it if the person has the original Medicare or if they're in a health plan, also known as an Advantage plan. You can actually tell it exactly what plan it's in if their person's in if you want to. The most important thing down here is you do have to tell it you want to add drugs if you're doing the plan finder with adding drugs. If you don't, it will skip past the drug search, and the main reason we do the plan finder is to enter the person's prescription drugs, so you want to make sure you add that information. You can also just click I don't know for the first two questions, and it will assume that you have original Medicare and you don't have any extra help. Once you've done that, you can continue to the plan results, and here the next page is where you enter your drugs. So from a personalized search, you would go directly to this. From a general search, you would go here after giving some information about the person's plan. When you do a personalized search, you will see in the My Current Profile up in the upper right-hand corner the person's current coverage. Actually, even if you do a general search, it will reflect what you told the plan. If the person is enrolled in a plan already, you can actually see that in the My Current Plan profile slide. The important thing is to begin to build a list of the prescription drugs that the person is taking, and you do that in this type the name of your drug box. If you start typing the name, it will come up with the matches, auto matches, and usually you can find your drug. You can also, if you're having trouble with it, browse by the first name. Drugs names are tricky to spell, so you want to make sure that you're getting the right drug, and that is really helpful if you actually have a list from a pharmacy or the pill bottle. In this field, you see this person already added something called metformin HCl. When you click on Find Your Drug, I'll show you the next slide, it will, once you've saved one drug on your drug list, now you will see a drug list ID and a password date and a zip code. This is how you can then from there on out retrieve this saved drug list. So these are the numbers that it's important for you to jot down somewhere, because if you're building a big long list of drugs and you lose your connection or something happens, you'll have to start all over again unless you remember this number. So I say when it first comes up, write it down, then you have it, you can pull it back up again without starting completely from scratch. The next slide is going to show you what it looks like when you've chosen your metformin. So this person typed in metformin in the Find My Drug list. Up pops the list of drugs, and now you select the dosage. And you want the dosage to match as close as possible to what the person is currently taking because it will give you the best pricing. In this case, this person is taking 1,000 milligram tablets. They're taking 60 of them every month. So, and they are right now getting their medicine from a retail, not a mail order pharmacy. This link will default to the most current dose, most common dosage that a person generally will take. But again, if you can make it match as close as possible to what the person currently takes, you're going to get better pricing. Regarding the quantity, this 60 per month implies that they take 2 pills a day. So quantity generally works like this. If you take 1 a day for a month, it's 30, 2 is 60, 3 is 90, and so on and so forth. And of course, you would increase that if you fill every 2, 3, or 12 months. Most pills, for the most part, are filled monthly, or if they do mail order or if the prescription is written for a 90-day fill, they're going to do every 3 months. Again, I would try to make it match as close as possible the current way they're filling their prescriptions. One other feature that the Plan Finder has is it will let you know if there is a generic available for the drug if you selected the brand name. And this is important for a couple reasons. First of all, a lot of people know the name of their drug by the brand name, even though they take the generic version of it. So if they don't remember the generic name, this will cue you in. So in this case, the person says they take Lipitor, which is a brand name drug, and we put it in the Plan Finder, and then this little box will pop up to let you know that there is a lower cost generic. You can then ask the client, do you actually take the brand name or the generic? In most cases, they're going to say, yeah, I take the generic. So you'll let it actually defaults to using the lower cost generic, and you can click on continue. In some cases, they might say, I have to take the brand name version because of whatever reason. You'll want to make sure you tell the Plan Finder to use the brand name version. In general, the generics are going to save them money, so that's the purpose of it. Once you have added all the drugs, and you can add up to 25 drugs, it's unusual for a person to take that many, but it is possible for people to take several. That's why you want to save that list so you can go back to it if you lose it. Once you've added all the drugs to your list, you can then click on My Drug List is Complete, which will allow you to move to the next step, which is selecting a pharmacy. You also, at this point, can click on Print My Drug List if you want to get a list for the person, for yourself, or for the person to hang on to. The drug list, I don't have a sample of what it looks like, but it is nice. It puts out the list of drugs with the frequency and quantity. It also prints on that list the drug list ID and the password date and the zip code, so it's a nice little thing to remember in case they want to go back into the Plan Finder. So the next step, once you've made your list of drugs, is to select your pharmacy. Pharmacies are important because they're going to get a better estimate of your costs, because pharmacies can be in a network, and in some cases, some pharmacies have what they call preferred network pharmacies that actually offer lower drug prices than other pharmacies in the network. So it's possible that a plan could have a broad pharmacy network, but a smaller preferred pharmacy network, and the beneficiary would possibly get better pricing at a preferred pharmacy. So that depends on the plan. Not all plans have that, but it's important to know most people want to save as much money as possible um, by choosing the best pharmacy. So what happens when you go to select your pharmacies is it's going to auto populate a list of the pharmacies within a distance from the zip code that you entered for your client. In this case, it found 22 pharmacies within 3 miles of this zip code. The distance the search goes out varies depending on how urban or rural the area is. So, it could be 1 mile in a dense urban area, it could be, 15 miles or 20 miles in a rural area. But what it will do is find the closest pharmacies. They're alphabetical, and in this case, we're only seeing a few of them, but there could be on more than one page. So in this case, you can click on Add Pharmacy. You can add up to 2 pharmacies. You can go back and change pharmacies later to kind of see if you want to change, if that makes a difference in changing the cost. But I would start with the person's preferred pharmacy, especially if they have a relationship or a reason why they want to stay with the pharmacy that they've been going to. You would want to try to see if you can find them the best prices at their current pharmacy. So once you have chosen, I would choose 2 pharmacies, the one they prefer, and then maybe another chain pharmacy or something in their area, just to kind of get a sense of if there's a difference in prices. Once you've chosen 2, you click on, again, Continue to Plan Results, which takes you to your refining plan results page. And a couple things I want to point out about this page. You can make a lot of choices from here, and you also can learn some stuff. First of all, this is an old screenshot, but when open enrollment starts in this October of 2018, you will see this information where you can current view. It will tell you when open enrollment starts that you're viewing 2019 plan data, which it would be for the upcoming year. But there will still be some people, like in October, November, that are going to need to enroll in a plan for the current year. So you can also click on this link to basically toggle over to the current plan year, which in this case would be 2018. Even though this is an old screenshot, it's the same. It will work the same way. That should be loaded approximately October 1st of 2018. Right now, if you were looking at the Plan Finder, we're talking about August of 2018. You're going to just see 2018 plan data. Okay. A couple other things. You can refine your search further on the left-hand side of this column and of this page, and so you can play around with a couple different things. I generally recommend leaving it wide open so you get the broadest arrangement or array of plans to choose from, because you just want to look, at it. But you can play around with refining your search. The one I really want to mention, though, is the special needs plans. If you want to look at special needs plans for your client, those would be generally Medicare Advantage plans that are for special needs, such as dual eligible or in a skilled nursing facility or getting some kind of long-term care. You do need to select those plans. If you click on the plus arrow, a menu will open up and you can choose them if they are available in the area where the client lives. Regarding the dual eligible plans, the other tip on this is that you won't be able to see the options unless either you've done a personalized search and the Plan Finder tells you that the person is dual eligible. They know the current subsidy that they have extra help or they're full dual eligible. If that is the case, then you can look at the special needs. You will be allowed to look at the special needs plans for dual eligible. If you need to do a general search, you need to tell the Plan Finder that the person is dual eligible, or you will not be able to look at these dual plans when you're doing your Plan Finder search. So that's just a little snag for people who are looking at that. Generally, I go over to my summary of search results, and in this case, this person has 39 plans available, including original Medicare. And you can select one or more plan types to continue. And your options are, the first one is prescription drug plans. Those are standalone drug plans. If you put a check mark in that box, that's what it'll show you. You can look at one or two or all three of these. The next option are Medicare health plans with drug coverage. That is Medicare speak for Medicare Advantage plans that include prescription drug coverage. This person has 10 plans available. Remember, depending on where the person lives, you may have 0 or 1 or 2 or a lot. And then the last option is Medicare health plans or Advantage plans without drug coverage. If you're doing a plan finder search and you're putting in prescription drugs for a person, you really don't want to go here because the person wants to get their drug coverage. So in general, I would just click one or the first two depending on what the person is searching for. However you do it, play around with it, see what kind of information it'll give you when you're practicing, and then continue to plan results. The example we have in the next slide, the person clicked all three of those buttons. So this is where what you'll get when you click on those. So again, here's the prescription drug plans, the Medicare health plans with drug coverage, and the Medicare health plans without drug coverage. Clicking on the plus button will open that up so you can see in it, and the next slide will show you what it looks like. Right now they're kind of closed so you can't see the information, but clicking the plus button will open that list up. A couple other things at the top of the page, you'll see some symbols. Those will show up if the plans have these options, and that might be helpful, especially if people are looking at Medicare Advantage plans. Some of them include dental, vision, or hearing coverage, so this shows you that, and you can see at each individual plan. If they have that, again, a caveat for you with counseling people is just because they have that symbol doesn't tell you a lot about the actual coverage, so the devil's in the details. You got to look into the plan details to find out what kind of dental or vision or hearing coverage they have, whether it costs extra, whether there's limits, and so on and so forth. Nationwide coverage means that the plan is available nationwide. Okay, so I will move on to the next slide, which shows you what this person is looking at. So they clicked on the plus arrow under prescription drug plans, and here's how the information comes up on the plan finder. It's showing that you can update your search. You can view and edit your drug and pharmacies list from here. That's the main thing that I would recommend you might want to do from here. You also can return to the previous page, and I didn't point that out on all the pages. You should have that information. This person is in Original Medicare, so it's going to come up with your current plan being Original Medicare, which in drug does not really cover outpatient prescription drugs. So you'll see that they're saying that the retail cost of that one, I think it's only one drug is on there, is $2,100, which might freak people out, but it doesn't really mean anything other than they have Original Medicare with no outpatient prescription drug coverage at this point. The prescription drug plans, in this case, they came up with 23 plans, and the next slide I'll show you a little bit more details. They come up sorted by lowest estimated annual retail drug cost. You can click on this down arrow and sort them by alphabetically or whatever. Also, it'll come up with 10 plans. In some areas, we have a lot of plans available. You can click on View 20 or View All to see your full list if you need to see that. So learning to navigate around in here is really helpful, I think. So sliding further down that list, here's a list of the plans, and they have come up by, I believe, by lowest annual retail drug costs. And so estimated annual drug cost is the left-hand column. It'll tell you what the cost is as of today or for the rest of the year. It'll tell you the premium, the drug deductible, whether the drugs are on the formulary, whether there's any restrictions, and so on and so forth. So as you get into this, you can look in more details. What we recommend doing is comparing 2 or 3 plans for someone so they get an idea of what's best. Generally, I recommend letting it come up with the lowest annual retail drug cost for the open enrollment year and clicking on the 3 lowest plans. This little box right here, which I can't make a click into, you can click and put a check mark. And once you click up to 3, you can click the brown button that says Compare Plans, which doesn't show up on this page. And you'll come up with a side-by-side comparison of 2 or 3 plans. The next slide shows that. So here is a plan comparison. In this case, the person selected, I'm not exactly sure why, original Medicare as one of the benefits. And then in this case, we can see the person has chosen a Medicare Advantage plan. We know this because it says the plan type is HMO and the plan type is HMO, okay? You'll see that there's some symbols, vision and hearing, and national plan is available nationally. Medicare is available nationally. Some basic information. The important thing to notice also is this comes up on tabs. In this case, we're on the overview tab. You can see that because it's green, so it's going to give you some overview. When you want to look at the health plan benefits, which is for a Medicare Advantage plan, you want to look at the health plan benefits as well as the drug cost benefits. You're going to have to click on these different tabs. So first tab would be health plan benefits to show what your Advantage plan benefits and costs are, and then your drug costs and coverage tab, which shows the drug costs. In a standalone prescription drug plan, you're mostly going to focus on the drug costs and coverage tab. There are some other tabs about star ratings and other things you can look at too, but we're mostly focused on pricing when we're doing the plan finder for people, so I'm going to focus on what I do when I talk to a client. Okay, so let's look at the benefits under health plan benefits. So again, these same 3 plans, original Medicare, which does offer health benefits, and 2 different Medicare Advantage plans, which of course offer health benefits, will show the coverage. So in original Medicare, as we know, original Medicare Part B pays 80%, leaving you with 20%. Advantage plans generally have co-pays, co-insurance, and so on and so forth. So in this particular example, which was from a couple years ago, these plans had a $400 co-pay for ambulance in one case and a $275 co-pay for ambulance in the Advantage, the AARP plan that was on this list. So this is really important for people who are looking at Advantage plans to get a sense of the most common out-of-pocket costs, what it will be for them, because it varies from plan to plan. So you want to make sure you review that with people that are looking at enrolling in a Medicare Advantage plan. The next tab we're going to look at is the drug costs and coverage tab. And again, this is the one I focus on the most when we're doing Plan Finder for people that are taking prescription drugs. There's a lot of information. This comes out with a big, long list, and I'm going to show you sort of piece by piece what's in there. Again, the plans are going to come out 3 side-by-side, 2 or 3 side-by-side. First thing is the fixed costs. The fixed costs include the premium, the deductible if there is one, and you'll notice when you look at Medicare Advantage plans, the plan is broken up into a drug premium and a health plan premium in most cases. The person has to pay those 2 added together, so it can be a little confusing. So make sure they understand that. If they're going to get the all-in-one, they're going to pay both the drug plan premium and the health plan premium. The next slide is going to talk a little bit more about how to get some more details about comparing costs. So as you slide down this same page, this is another clip of that, these are the information that's going to be helpful to you. It's going to tell you if you enroll in January and you bought all of those prescriptions with no coverage, of course this is original Medicare, it'll cost you, they estimate, over $2,100. If you chose the Aetna plan and enrolled in January and went to CVS Pharmacy, which is one of the 2 pharmacies they selected, the cost will be $438.72. This is a very important number. This includes the premium that you would pay every month for the full year, the deductible if there is one for the drug coverage, and then your copay or coinsurance every time you fill your prescription. So this breaks it out by the two different pharmacies, and you'll notice that it's almost the same between the CVS and the Annandale pharmacy, but it's not exactly the same. Mail order, as you can see, in this case, saves a person quite a bit of money. So you can only choose two pharmacies at the beginning, and they need to be brick and mortar pharmacies. The mail order costs will show up when you get to this level of the search, and you can't choose mail order pharmacy as a pharmacy. It will show up because each plan uses its own mail order system and has its own mail order prices. So what you're seeing is that plan's mail order system and prices. Not all plans offer mail order, and not all plans will save you money by mail order, but it's definitely worth something worth looking at for some people because they can save a fair amount of money on that. The other thing I want to point out is all through the Plan Finder, you'll see these little blue question marks in brackets. If that explains what it means here with what that topic means, and if you click on that, it will open up a little box that explains what it means. So very helpful to look at that if you're confused about what they're talking about, or if your client needs more information about what they're talking about. The AARP Medicare Complete Plan, the one on the right, it's interesting, the costs are the same at both the pharmacies, and you would save some money by enrolling in mail order, but not nearly as much as the Aetna plan. So you'll see a lot of variation in costs based on pharmacy you go to, and also whether you do mail order or brick and mortar. You can delve down even deeper into the costs. Further down the page, if you slide down the page, there is a month-by-month cost estimate by plan. And also there's if you click on this little monthly cost estimator, you can click on this little picture of a bar chart, and it will take you to a bar chart that shows month-by-month costs by plan. You can toggle between your different pharmacies that you've added, and this is a different screenshot, but in this case they did CVS, Fred Meyer, and mail order. You can toggle between enrolling in January, or if you're enrolling mid-year, enrollment today. In this case, it's showing a whole year. So it shows, in this case, the first Health Part D Value Plus drug, and the next one, the Envision RX Plus, at the CVS pharmacy. And it breaks down the costs by premium, deductible, they're color-coded, copay, if there's a gap, or catastrophic coverage. This is really helpful, especially for a person whose coverage makes their costs vary from month to month. For example, you'll see a chart sometimes where the first couple months bars are kind of high because there's a deductible. Then the bars become shorter because they've met their deductible. And if they have a lot of high drug costs, perhaps they go to the catastrophic level of coverage, or the coverage gap level where they have to pay a higher percentage. So you can see in some cases these bar charts will be high, then low, then high again throughout the year. It's helpful for people to see that so they can kind of plan ahead or get a sense of the fact that their prescription costs might vary from month to month based on where they are in the cost breakdown of a drug plan. Other things to look at are, if sliding down that page, is whether or not the drugs are on the plan's formulary. Of course, it's really important for a person to choose a plan, for the most part, that where all their drugs that they put in are on the formulary. One thing the Plan Finder does is if the drug is not on the formulary, as you can see over here, this is original Medicare. Again, we've gone back to this particular generic Lipitor is not on the formulary. There aren't any restrictions either. You can pay it, but the price that's shown in the Plan Finder is going to be the full cash price. So that's kind of how that works. One of the things you want to look for are whether there's any restrictions. So first of all, are all the drugs on the formulary? And the second one is, are there any restrictions? There's three ways Medicare restricts drug um, access. The first one is quantity limit. So that is generally for safety reasons, sometimes for cost reasons. They'll only allow you to get maybe 30 pills a month or 60 pills a month, depending on the prescription. You can click on the actual quantity limit. You can see it's kind of a hyperlink because it's blue, and it will tell you what that plan's restriction is. If it's no more than if the limit is not less than your client is currently taking, it probably won't be an issue. The other two ways that the plan's limit is by requiring a prior authorization for a prescription. In general, that will mean your physician or someone will need to send some information to the plan. Could be that you need to have a certain diagnosis in order to get the prescription. So that can be an issue. And then the last one is something that's called step therapy. And that is probably the most complicated, but it means that you probably have to try something usually less expensive and see if it works before you're allowed to have the more expensive drug. So again, look for these when you're searching for someone's drugs, because you'll see this is a good example. In this case, both the drugs the person takes have a quantity limit in this column, but they don't in the other column. So different plans have different levels of restrictions. The other thing this is going to give you is the pharmacy and mail order information. It tells you that there are network pharmacies in the zip code and that there is a preferred pharmacy network available. You can click on that for more information. Remember, a preferred pharmacy could give you better pricing. If you click on the pharmacy information, you can go to back kind of to your search page for pharmacies, and it'll tell you the pharmacies that are nearby, whether they're preferred, whether they're retail. You can remove or add pharmacies at this point to get a sense of whether that changes your pricing. Okay. What I forgot to show you when I was looking at the pharmacy, when you are at your pharmacy selection, either when you're first building your search or at this point, you can search by new location or pharmacy name. Remember, it's only going to show, in this case, it's half a mile from their zip code. You can search further out if you're looking for a specific pharmacy or more choices. Or if the person says, I always go to XYZ pharmacy and it's not showing up in their search because it's too far from where they live, you can search by new location and enter either a new zip code or even the name of the pharmacy and bring it up. So you can tweak the pharmacy list to show pharmacies that don't automatically show up based on location from the zip code. Okay, let's say this person has decided that their Aetna Medicare Innovation Prime plan was the best one for them. It covered their prescriptions at the lowest cost for least restrictions. The doctors participate. They're comfortable with the cost sharing and the network and so on and so forth, and they're ready to enroll. When open enrollment starts on October 15th, this enroll button will be activated on the plan finder. So you can click on that button and it will take you to the enrollment gateway. So that is one way to enroll. You can also enroll, the client can enroll by calling the plan. Here's the phone number right here. They can be enrolled over the phone by the plan, or they can call 1-800-Medicare, and 1-800-Medicare will also enroll them if they know exactly what plan they want. Remember, 1-800-Medicare is open 24 hours a day, 7 days a week, and when we get late into the enrollment period, that might be helpful to know. We recommend either using the online enrollment gateway or 1-800-Medicare because you have some documentation of how it went. So that's kind of helpful. But if there are questions that the person needs to ask of the plan, they should call the non-member or member number, probably non-member if they're considering enrolling in the plan and have questions about it. When you click on the Enroll button, it takes you to something called the Enrollment Gateway, and it takes you through a series of questions to fill out. So if you're assisting someone to enroll, which is something that is within the scope of Sheba work, as long as you feel like they know what they want and they're comfortable with their enrollment, during an open enrollment from October 15th to December 7th, a person can actually make multiple enrollments. Not that we recommend it, but the last enrollment they make during that period is the one that takes. So if they come to you and say, gosh, I enrolled on October 17th in XYZ plan, but now that I've talked to you, I really think I need to enroll in ABC plan, you can help them enroll. That will overwrite the enrollment that they did earlier in open enrollment. That's the only enrollment period where you can make multiple choices. So remember that. But when you do this enrollment, if you help someone with it, they need some information. They need their address and phone number and so on and so forth. They also will need information from their Medicare card, their Medicare number and effective dates. So it's helpful if they have that information. When you get to the end of this enrollment, there is a confirmation page that comes up with a confirmation number, and I highly recommend printing it out or saving it so that they have that. I would give it to them. It has the plan information and some other phone number and information that shows that they have enrolled. It's a pretty quick process, only takes a few minutes, so it's really something you can do to help people get started. Let's talk about results, though, before we get too much further into it. So some important information about the results on the Plan Finder. The plans do send updated pricing information to CMS on a regular basis, and it gets uploaded at least every other week into the Plan Finder. They do freeze the pricing during the month of September each year, but after that, plans with their every other week upload, the pricing can change. So the pricing that is posted on the Plan Finder is based on the full retail price that the plans have negotiated with the drug companies, and it varies from plan to plan. So the pricing results are an estimate, and we just want everyone to know that prices can change during the year. It's the best tool we have. It's helpful as a basis of comparison, and clients can learn if their current drugs are on the formulary. That will stay the same with very few exceptions throughout the year. They also can learn if there's those restrictions like quantity limits, et cetera, and what tier level they are placed at on each plan. I didn't talk about tier level, but that affects the cost sharing amount. So what I'd focus on for results with someone are the costs. That's that January or the rest of year cost. That's the one that includes their premium, their deductible, their copay or coinsurance estimate based on their prescription entered, and actually the pharmacy that they're using too. So that's covered on slide 22. Also, coverage. Are all their current drugs on the formulary? And are there any usage restrictions that are going to affect them? We can't predict what drugs someone's going to take in the future, so we have to focus on the drugs they're taking on a regular basis. And then the last one is convenience. Does it work either with their preferred pharmacy or mail order, or are they willing to change? Sometimes when you show the numbers of the difference in costs, the beneficiary will say, hey, I'll try mail order, or I'll try a different pharmacy because I know, it could save me, up to a couple $100 over the course of a year or more, so might be worth it for them to change. Okay. Printing and sharing results. I've put together a job aid on how to print and share a customized Plan Finder report. I'll show it to you in a minute. It's a separate handout, but there is a way to print the results that you can then hand to a person or paste into an email or attached to an email to someone so they can take it away with them if they want to think about it. Lots of times people want to take a look at that, maybe call the plans that you've come up with on the Plan Finder and ask questions before they're ready to make an enrollment decision, and that's certainly up to them. You just want to make sure they know how to enroll. They can enroll again by calling the plan, calling 1-800-Medicare, or going online. A few things about help. At the top of the page, I think it's on every page, but it's definitely when you get to the general search and personalized search page, there's a button called Help, and you can click on that, and it will bring up a bunch of different things, including frequently asked questions, which answers a lot of really good questions about the Plan Finder, and also a help in how to use the Plan Finder. There's also some tips for printing, which I haven't found to be that helpful, but I want to make sure you know about those. I'll show you these sites in a minute as also, but I want to get through this slides here. The next thing is while you're using the Plan Finder, volunteers often find some issues. During open enrollment, especially the first few days that the Plan Finder is posted with the 20, in this case, the 2019 plans, the Plan Finder can sometimes be a little wacky and go down. But if you have questions or issues about the Plan Finder, be sure to feel free to contact me. There's my contact information. If we have issues, we have to report them to the Administration on Community Living, which is our SHIP TA center. There's an intake form that we have to use. So it has to be something that we can basically recreate. So I can certainly tell you if the Plan Finder is going down a lot or if there's something happening, and I encourage you to let me know. But if it's just something vague and we can't recreate it, we're not going to be able to report it to Medicare. So there is a form I can send to you if you have a problem. You have to be able to give some detail, like what page you were on, and what kind of search you were doing, and so on and so forth. And I'm happy to do that. If I get notifications of known issues, I will send them out to the volunteer coordinators, and they ask them to distribute them to you. But you guys are the eyes and ears on the ground, so if you're running into stuff, let me know. Some other resources that you might want to look at, there's an open enrollment toolkit that CMS posts, which includes a bunch of information that might be helpful. There's also a document talking about enrollment periods that's very helpful in terms of understanding when people can enroll if it's not open enrollment. And those 5 step-by-step videos I showed you how to get from the Plan Finder, here's a link you can go right to. I think they're posted on YouTube. And of course, the My Sheba page, which we have quite a bit of information posted. So that concludes my slideshow. There's a few other things I want to show you. Let's see if I can remember how to move around in this. Okay. Remember I told you there's the frequently asked questions from the help page. It's a really helpful, it really covers a lot of the information that comes up when people are using the Plan Finder. The very first question on there is, why can't I add an existing drug? Why isn't it listed? It gives you some great tips. So I highly recommend taking a look at that page to get your general questions answered. Also, the help page takes you through the general search and the personalized search step by step, how to find it, how to enter your drugs. The OIC or Sheba also has a Plan Finder instructions that is posted on My Sheba. This is a publication that can be shared with clients. So if you had a client who says, I want to do it myself, you can give them this. This will tell them how to get started. It also is helpful to you. It's a nice little summary. I think it's only 2 pages long, and it kind of gives you the step-by-steps. Basically, you enter the information, you enter your drugs, you choose a pharmacy, and then you refine your results as I've showed you. Um, let's see. I don't think I need to show you this page, so I'm going to show you the Plan Finder worksheet. We also have posted on my Sheba some sample Plan Finder worksheets that we put together. They see this is Dick Tracy. But you could, if you wanted to use these to practice the Plan Finder, I can't give you information with a Social Security number or a Medicare number to do a personalized search. Unfortunately, that would be um, uh, um, not secure. If you have Medicare yourself, you can put in your own information, but that you can practice using a general search, of course. And here's a list of some drugs to use on these. So this is posted on the MyShiba page, and if you need to know where that is, I can let you know. It's from last year's training, but it's still good. So here's a list of drugs that you can use to practice using the Plan Finder to get familiar with the tool. I believe, let me check to see if there's anything else I wanted to share with you. Oh, the Plan Finder drug list. So I mentioned there also is a tool that I have developed that tells you how to print a customized Plan Finder drug report. It also is posted on my Sheba. Again, if you need that, I can tell you where it is. Maybe we can add the links to when we post the webinar. I'm not exactly sure how we do these things, but it takes you step by step on how to print the Plan Finder tools. I believe that that concludes my presentation. Let me see if I can take you back to my welcome page. So that is the end of my presentation. I encourage you to ask questions and get in there and practice. Thank you so much for your time. I appreciate it. I'm going to stop recording now.